Hello everyone. In this presentation, I would be talking about Catherine Kolcaba and her comfort theory. This theory was developed in the 1990s and it is a mid-range theory. Each concept is operationalized, thus it is a practice-level theory. Kolcaba's purpose of the comfort theory is to highlight the importance of comforting our patients in this high-tech world, and I share her belief. Before I present the theory, we need to peep into Kolcaba's background. It would be easier to understand the theory by first knowing the theorist. She was born on December 8, 1944 in Cleveland, Ohio. 1965, she graduated from St. Luke's Hospital School of Nursing of Cleveland. In 1987, graduated MSN, and in 1997, graduated with PhD in nursing and received Certificate of Authority Clinical Nursing Specialist. She specialized in gerontology with other fields of expertise such as end-of-life and long-term care interventions, comfort studies, instrument development, nursing theory, and nursing research. She is currently an associate professor of nursing at the University of Akron College of Nursing. She published Comfort Theory and Practice, a Vision for Holistic Healthcare and Research. Prior to her work, there are some people who influenced her. One is her father, who died when she was just 8. Later on, her brother died of cancer at age 43, and she was doing her dissertation of breast cancer during that time. And of course, her husband, a philosopher who is very supportive of her work. As she began to the concept of comfort, there are 3 nursing theoretical sources: Orlando, Henderson, Patterson, and Ziderad. She also borrowed Henry Murray's framework. He was a psychologist and his theory was about human needs. When Kolcaba was presenting her framework for dementia care, an audience member asked her, "Have you done a concept analysis of comfort?" Kolcaba's reply was, "No, but that is my next step." This began her work on the concept of comfort. There are multiple definitions of comfort, and Kolcaba's definition is a state that is experienced by recipients of comfort measures. It is the immediate and holistic experience of being strengthened through having needs met for the 3 types of comfort in 4 contexts of experience. These are the concepts of comfort theory. The first one is healthcare needs. It is defined as needs for comfort arising from stressful healthcare situations. These include physical, psychospiritual, social, and environmental. The most frequent is relief from physical pain. The next is comfort measures. There are nursing interventions designed to address specific comfort needs of recipients, including physiological, social, financial, psychological, spiritual, environmental, and physical intervention. Giving medication for pain is an example. Hand massage is another. The next one is intervening variables. It is defined as interacting forces that influence recipients' perception of total comfort. There are factors that each patient brings to the healthcare situation that nurses cannot change, and that has an impact on the success of the interventions. These consist of variables such as past experiences, age, attitude, emotional state, support system, prognosis, finances. An example is the normal aging process or dementia in patients. Such as in Kolcaba's experience in dementia care, she said that she had to be a nurse detective because patients couldn't verbalize why they were uncomfortable. With Kolcaba's definition of comfort, there are 3 types of comfort. It is relief, ease, transcendence, and it is in four contexts of experience: the physical, psychospiritual, social, and environmental. I would like to share this information that I came across as I was doing the research for this presentation. There is a U.S. Navy ship. It was originally an oil tanker in 1976, and the ship was changed into a hospital ship. One of her duties is to provide mobile surgical hospital services for disasters or humanitarian relief. One is when the Haiti earthquake occurred in 2010, and the ship's name is Comfort. There are three types of comfort in four contexts of experience. For it to be measurable, kolcaba developed a taxonomic structure. It is a 12-cell grid where it enables the nurse to, number one, identify comfort needs, number two, design interventions to satisfy those needs, and number three, to measure the effectiveness after implementing the interventions. Kolcaba's definition of comfort is a positive concept. It goes beyond physical. That is the reason why she later added the four contexts of experience. These were borrowed from literature review about holism. This is physical, the bodily sensations; psychospiritual, the internal awareness of self; environmental, external surroundings, conditions, and influences; and social, interpersonal, family, and societal relationships. There are three types of comfort, and in four contexts of experience. Number one is relief. It is the state of a recipient who has had a specific need met. It was borrowed from Orlando. One example is in the picture: a baby crying. He may need relief from hunger, pain, or tiredness. Another example is an elderly patient who was assisted to the comfort room. Relief is usually an immediate outcome after intervention. The second type of comfort is ease. It is the state of calm or contentment. It was borrowed from Henderson, and an example is the baby who was crying of hunger experienced relief when he was given the milk. He is now in a calm and contented state. The elderly experienced ease as he is constantly visited in the nursing home by his partner. And last type of comfort is transcendence. It is the state in which an individual arises above his or her problems or pain. It was borrowed from Patterson and Ziderad. Continuing with the given examples, the toddler experienced transcendence as he arises from his disability, as well as the elderly who has accepted his confinement and motivates himself for optimum functioning. Going back to the remaining concepts, next is health-seeking behaviors. It represents the broad category of subsequent outcomes related to the pursuit of health. It could be internal, external, or a peaceful death. When comfort interventions are delivered consistently and correctly over time, increased levels of comfort lead to a desire for health-seeking behaviors. Example is internal, such as healing, or external, wherein patients would be engaging in health-related activities such as incorporating the proper diet after attending health teachings. Last of the concepts is the institutional integrity. It is defined as communities that possess qualities or states of being complete, whole, sound, upright, appealing, honest, and sincere. Stability and ethics of any hospital, healthcare system, region, state, or country. When institutions do better, patients do better, and vice versa. Examples are when the institution receives a recognition or award such as a magnet, or when the length of stay in the hospital of the patient is shortened or readmissions are lessened. This is the meta paradigm of the theory. First one is the patient. They are the individuals, families, or communities in need of health care. The nursing is the assessment of comfort needs, and then designs are made for comfort measures to address the needs, and reassessment of the comfort level after the implementation, and it is compared with the baseline. Environment are the surroundings that can be manipulated by the nurses or loved ones to enhance the comfort. And last is health, which is the optimum function of individual or the family or the community, facilitated by attention to comfort needs. This is the conceptual framework of the comfort theory. Healthcare needs of the patient or families identified, then interventions are designed to address those needs. The intervening variables are taken in account, and thus the outcome is enhanced comfort. The patient then engaged to health-seeking behaviors, which may be internal, external, or a peaceful death. And this one leads to institutional integrity, making the institution flourish and viable, resulting in development of best practices and best policies. Here are some examples of the instruments created by kolcaba to measure comfort. Comfort daisies are for pediatric patients, and the general comfort questionnaire has a long or short version depending on the clinical setting. These are just a few. She was able to create different instruments to address specific settings or patients, and some are even translated to other languages already. The critique of the theory. Theory of comfort is understandable because of its consistency in the terms used. Simple because comfort is a basic nursing care, and the theory can be applied repeatedly but individualistically. Comfort is intuitive, making it easy for nurses to apply it, and is operational, enabling the nurse to see the effectiveness of the interventions. Setback is the evolving healthcare technology and decreasing ratios in staffing, compromising the promise of giving a holistic nursing practice. Adding the institution in the theory gives everyone a sense of wholeness, as everyone is on the same page in view of comfort in healthcare. This is a case scenario where the theory is applied. There's a 40-year-old female who was transferred to the unit with a diagnosis of DM and was post right lower extremity amputation. As the nurse finished with the endorsement, she noticed patient was crying. She wants relief from the post-surgical pain and was asking for her meds. It was her first major hospitalization, and she was overwhelmed and angry. She needs to ease her anxiety and be in a calm state. Why her? She asked repeatedly. How would her family cope up with her disability, especially her husband? She is worrying how they are going to manage financially if she can't work anymore. As the nurse gave her medications, she explained the importance of having a support system, and her family is one. Her husband just called the unit to inquire her new room number and told the nurse they're coming to visit. The nurse informed the patient. The husband also explained that they were rearranging the house so her wife would not have a hard time maneuvering her way around when she comes home. Nurse verbalized to the patient that they are going to manage, as she has a very supportive and caring family. Before the nurse left the room, patient requested for a physical therapist to discuss her first rehab session. It is a sign of transcendence wherein she arises from her current health problem and engage in health-seeking behavior. The end. Thank you.